For what purpose does the gentleman from Pennsylvania seek recognition?
Mr. Speaker, I move to suspend the rules and pass S-1557, the Children's Hospital GME Support Reauthorization Act of 2013.
The clerk will report the title of the bill.
Senate 1557, an act to amend the Public Health Service Act to reauthorize support for graduate medical education program in children's hospitals.
Pursuant to the rule, the gentleman from Pennsylvania, Mr. Pitts, and the gentleman from Texas, Mr. Green, each will control 20 minutes. The chair recognizes the gentleman from Pennsylvania.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection, so ordered.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized.
Mr. Speaker, I'm glad that today we will pass a bill that will help keep American children healthy. Today, the House considers S-1557, the Children's Hospital GME Support Reauthorization Act of 2013. This is companion legislation to my own bill, H.R. 297, which passed the House at the beginning of this Congress. I'm pleased that we've worked out the slight differences between the bills and that we can now reauthorize an important program that makes sure our nation has enough doctors trained to treat children. The Children's Hospital Graduate Medical Education Program helps encourage more young doctors to pursue this important specialty. Without it, we would certainly see fewer medical professionals enter pediatrics and pediatric subspecialties. Children need doctors trained just to treat them. Nationwide, this program supports the training of more than 5,000 doctors. Locally, in my area of Pennsylvania, the Children's Hospital of Philadelphia participates in the program, and I've had the privilege of visiting the hospital a number of times and meeting with the young patients and the doctors, learning how to treat them. And I'm proud to have worked on this legislation with Energy and Commerce Health Subcommittee Ranking Member Frank Pallone. We originally introduced this bill in the 112th Congress. It's been a long road, and I'm glad we can finally send this bill to the President for his signature. This is yet another bipartisan bill that we've successfully moved through the Health Subcommittee. It's proved that despite our differences, we can find common ground and work together on legislation in a bipartisan way to help Americans stay healthy. And I'd like to thank especially Monica Volante on my staff, as well as the staff of the Health Subcommittee, especially Brenda Destro and Katie Novaria, who worked tirelessly on this legislation. And I urge all of my colleagues to support this bill, and I reserve the balance of my time.
The gentleman reserves the balance of his time. The chair recognizes the gentleman from Texas.
Thank you, Mr. Speaker, and I ask unanimous consent to submit a full statement. I rise today in support of the Children's Hospital GME Support Reauthorization Act, which reauthorized Children's Hospital Graduate Medical Education Program through 2018. The Children's Hospital Graduate Medical Education Program provides vital funding to support training of pediatricians, pediatric specialists in our children's hospital. Continued strong support for CHGME is essential to maintain this investment in our children's health care. Reauthorizing the Children's Hospital Graduate Medical Education represents a commitment to ensuring that children throughout the country have access to the quality care they need. Since its creation in 1999, this program has increased the number of pediatric health care providers, addressed critical shortages in pediatric specialty care, and improved access to necessary care. The recipient hospitals represent less than 1% of all hospitals, yet train half the nation's pediatricians and pediatric specialists. As a co-sponsored bill that passed in 2013 and a long advocate for Children's Hospital Graduate Medical Program, I applaud the bipartisan, bicameral effort to preserve and strengthen the important program. I want to recognize and applaud the leadership of our ranking member, Frank Pallone, our Chairman Pitts, on this legislation in the House. I also want to acknowledge the sponsor of the measure we are considering today, Senators Casey and Senator Isaacson, and I also commend Chairman Upton, Chairman Harkin, and Ranking Member Alexander for making it possible for the House to consider this bipartisan legislation today. I urge my colleagues to join me in supporting Senate Resolution 1557 and sending this legislation to the President for his signature. And I yield back my time.
The gentleman yields back his time. The chair recognizes the gentleman from Pennsylvania.
Mr. Speaker, I'm very pleased to ask all members to support S. 1557, very important legislation with bipartisan support, and I yield back the balance of my time.
The gentleman yields back the balance of his time. The question is, will the House suspend the rules and pass Senate Bill 1557? Those in favor say aye. Those opposed, no. In the opinion of the chair, two-thirds being in the affirmative, the rules are suspended, the bill is passed, and without objection, the motion to reconsider is laid on the table.